Okay, we are live.
Okay, this is the January 20th Community Services and Personnel Committee meeting. I will call it to order at 7:03. First item on the agenda is roll call, and I will go ahead and call roll call. Greg Burnett.
Present.
Dominique Johnson.
Present.
Tom Keegan.
Here.
Diana Revolus.
Here.
Kadeem Roberts.
Present.
Nick Sachinelli.
Present.
And myself, Barbara Smith. We have everyone here. Next item on the agenda is the approval of the minutes from the meeting held on November 18th, 2020. Do I have a motion? Mr. Burnett, any deletions, changes, additions? I'll just call for all in favor. Oh, Mr. Burnett?
Yes, on page 3, the third paragraph down, where it states, Mr. Morgan said the website is close to 1.2 visits. I think he meant 1.2 million or 1.2 gazillion visits.
Yes.
So
double check that one.
million or gazillion, whichever word fits best.
I think 1.2 million.
Yes, thank you.
Yes.
Great. That
Okay.
was the only correction I saw.
Okay. Anyone else? Additions, changes, deletions? Okay. All right. So all in favor of approving the minutes as amended? I'll do a show of hands. All in favor? Aye. Okay. Opposed? No opposed. Abstentions? No abstentions. Okay. Passes unanimously. All right, the next item we need to discuss is not on the agenda, which is just to approve the meeting dates for 2020-21. So I need a motion to suspend the rules to pass those meeting dates. Mr. Keegan moves to suspend the rules. All in favor? Aye. Opposed? Abstentions? Okay, passes unanimously. All right, and do I have a motion to approve the meeting dates? Ms. Revolus? All in favor? Aye.
Question?
Opposed? Ms. Johnson?
Yes, may I, Chair Smith, ask a question about, are we approving to meet in person starting in March, or is this just dates we're approving?
That's just hopeful.
I see.
Yeah, no, it's just the dates, and we will obviously move accordingly.
Okay, very good. Thank you for that clarification. Appreciate it.
Okay, again, all in favor? Opposed? Abstentions? Okay, meeting dates pass unanimously. All right, so we have some updates and presentations for the Community Services Department tonight. So, I just want to begin by saying that, so often we pass items, we approve funding, and we don't always get to see the results of that funding. I mean, if it's, something with, new building, of course we see that. But if it has to do with, human services, we don't always see that. So we're very lucky tonight to have a presentation from Mid-Fairfield Child Guidance staff about the funding that we approved last year for the influx of students who came to us from the border. And so we have that to look forward to, as well as this the presentation that Maria will give regarding the Family Navigator program, which was, of course, funded, through grants, not through the city. But again, we get to get an update of what's going on. So I'm going to turn it over to Lamont to give us a general update, and then we'll take it from there.
Sure. Good evening, everyone, and thank you, Madam Chair. So I'm really excited this evening, to be before you. As Madam Chair has indicated, our intent moving forward for 2021 to highlight the services that, from the community service perspective, that we are providing. And so, to her point, and in consultation with Madam Chair, it is my desire and goal to every month to share with you the programming that we are offering, whether it's grant funded or city funding, and also give an opportunity for the public to know what their city is doing and how engaged our city is doing in terms of how we are taking care often our most vulnerable children, our most vulnerable seniors, and then basically those that are just in need. Prior to, as we were preparing this evening's to go live, we were just talking casually around the food program. I want to remind all walkers that through your community services department, we have been successful to partner with Connecticut Food Bank, which is now Connecticut Food Bank and Food Share. And we are the only site in Lower Fairfield County hosted in our wonderful city at Calf Pasture to be providing food for people who need. And we were just talking about, this is not just for people who may, really be struggling, but we're also finding families or individuals for the very first time because of lack of employment or just the challenges of COVID, that they're in need for help. And this is a place of dignity, no questions. You're not being asked. We just ask you to open up your trunk and we'll put the food in. I've been wonderfully joined by Councilman Burnett, who participated in Councilwoman Darlene also, and encourage the public that if you would like to volunteer, if you go to the Connecticut Food Bank, just put Connecticut Food Bank Norwalk in Google and you can sign up. And thank you for also council leaders for promoting the event wide. We require about 45 volunteers. And I've never seen it. We posted it with your help and partnership. It broadcast throughout the city. And for the entire month of January and February, we have a waiting list. And I think that speaks to the testament of Norwalkers who saying, I want to help. I want to help my fellow citizen. So thank you all for your support because it requires resources. Thank you for allowing us to use Calf Pasture Beach every Wednesday. And also the police support. I want to recognize our fine police officers because we need them. And also Parks and Recs and DPW because it really takes a team effort to host an 18 tractor trailer that comes in and produces over 400,000 pounds of food. And we provide food for over up to 1,500 cars. And so to those who are watching, this will be every Wednesday. So more until further notice, every Wednesday, if you are in need of food, come to Calf Pasture by 8 o'clock. The gates open at 9 o'clock. In your city, this department is there to assist you. So thank you for that. And then secondly, in terms of update. Yes, I'm sorry.
I hate to interrupt, but I was reminded by Councilman Burnett, thank you very much, that that I missed public comments.
Oh.
And so I just want to make sure that if there is anyone who would like to speak from the public, that I make sure that I give them the opportunity to do that. And we do have a few attendees, I noticed. So, so Larry, can we check and see if anyone would like to?
Yes, if you'd like to speak, please raise your hand electronically now. As of now, I don't see anyone. We do have 4 attendees.
Full disclosure, they may be from mid-Fairfield. Their supporters listening in.
Yeah, I do apologize. I'm not 100%, with the surgery. So
Yeah.
Thank you again, Mr. Burnett, for reminding me of that. All right, go ahead, Ron.
Sure. So thank you. And then lastly, I know we've had a very robust and very rich discussion around the Equity and Justice for All Commission. And so I also want to provide an update to the Common Council that, as mentioned in our previous, we made a decision to reissue the RFP because the submissions that came through just didn't meet the criteria or the satisfaction that we believe is due to Norwalkers. And so we just closed the RFP process, and the selection committee that has been appointed by the mayor will be meeting. And this is not the selection committee because prior after we had our call, and then as I meet with people in the community, this is not the selection committee to serve on the commission. This is the selection committee to select and to recommend a firm to the mayor. And so that process, we just closed January 12th, hard copies closed January 14th. And so under our purchasing guidelines and ordinances, we are now pulling the selection committee together, and we'll be meeting to select a firm or to make a proposal or recommendation to the mayor. And I know it was asked, because I didn't have the names in front of me, so I want to go on record to make the official announcement of those that will be serving on the selection committee to select the firm who would really help Norwalk do the work around Equity and Justice for All Commission. And the selection committee individuals are Brenda Penn Williams, Norwalk Chapter President of the NAACP, Reverend Wesley Cart, President of the Interdenominational Ministerial Association, Jennifer Barahona, the Executive Director of Norwalk Acts, myself as the staffer, Camila Vallejo, who is a former Norwalk youth leader here in the city of Norwalk, Madam Chair Barbara Smith, Common Counsel, and Mr. Steve Ginsberg, representing the Anti-Defamation League. He's the Connecticut Regional Director. So this group will review the proposals, make a recommendation to the mayor, and then we're so hopeful and positive that through this new process that we tweaked and really looked at the proposal and looked at lessons learned, that we'll be able to announce over the next month or two the firm and then get to work. I think that's what we're all waiting for. We're ready to work and move forward. And then lastly, Madam Chair, I just want to remind our community that every other Friday, and some of you council leaders have begun to participate, and I hope that you find this very helpful, that every other Friday, our department, your department, City of Norwalk Community Services Department hosts a bi-weekly call with the community-based organizations and nonprofit social service provider leaders. And in this call, we talk about the present services, we talk about the needs, and we also work to come together and promote the variety of services and resources that are available to Norwalk. And so if you would like to participate and get the invite, please email myself, Lamont Daniels, at ldaniels@norwalkct.org. We would gladly send an invitation for you to participate on the bi-weekly call. And and we'll send out a summary. In our community, we have over 70 or so individuals on the call that is promoting other resources and services today. So that's my updates, Madam Chair. I don't know if you want me to go forward to go ahead and facilitate our special guest tonight.
Unless anyone has any questions? Mr. Burnett?
Yes, thank you. Mr. Daniels, just one question. Are you at liberty to share how many companies responded to the RFP? I know that was an issue last time that we didn't have.
Yeah, well, that's a great question, because I haven't spoken to our purchasing agent and I'm still learning our ordinances and what we can share publicly. I think at this point I reserve sharing more detailed information.
No problem. Thank you.
Thank you.
Anyone else? All right, proceed, Mr. Daniels.
Great. So as you know, the City of Norwalk, in partnership with Norwalk Public Schools, we're highlighting both partnerships with our Norwalk Public Schools, and really excited that we're doing some really good partnerships. The Family Navigator program, through a partnership with the Dalio Foundation and others, we are really excited that our city has been able to secure not only just digital support and Chromebooks, but also services, because we know that families during these times need help in a variety of ways. And so Maria Escalera, which is Norwalk's, you all met her already, but she hit the ground running and now she's moving very fast now, Norwalk's Human Services Director. And again, I just want to echo and remind the community that we're really excited that with this reorg, we're able to really take a real fine look and lens at the needs of our city. And I hope that you would agree with me that we're really doing a laser focus and try to make sure all Norwalkers have what they need. And so Maria is going to this is more of a progress update, Madam Chair, around the Family Navigator program, what we're doing, how many families we're serving. She has a brief slide deck, and then we'll entertain any additional questions. And then we're really excited to have our special guest, Ms. Fairfield, and we're really excited to talk about the program after Maria. Good evening, Maria, and I'll turn it over to you.
Thank you, Lamont, and good evening, everyone. Let me just pull up my PowerPoint. Can everybody see that?
Good job.
Right. Great. Okay. So thank you for allowing me to provide an update. As Lamont said, the City of Norwalk is partnering with Norwalk Public Schools to ensure that every Norwalk student has access to all of the technology needed to be successful in learning. So the goals of the program is to create a more equitable learning experience for Norwalk students by ensuring that all students have access to high quality, reliable internet. A survey was done over the summer after we launched or jumped right into remote learning in the spring because of COVID. A survey was done by the Norwalk Public Schools to understand who has access to internet and if that was a barrier to the education model that we were moving into. So having access to high quality, reliable internet, having the knowledge and ability to use the internet to fully participate in virtual learning, and to connect to existing wraparound services available to families in Norwalk. I think one thing we have learned is that COVID has not only shined a light on family members and members of our community who have needed assistance, but has also highlighted the need for resources and assistance for families that may not have ever had to utilize the nonprofit community. And COVID has really shown that to us. So there's a tier, we've created a tier level of support to really be able to maximize our resources and really support families. Our first tier is, we're asking every family that's referred to us is, do they have internet? Do they have access to reliable internet? And so that first tier is, if you don't have internet, we're gonna get you the hardwired internet connection. We've learned that some families were usually utilizing their cell phones for Wi-Fi to support multiple students and their devices, and that just wasn't adequate. So we really wanted that first tier of identifying students and families who needed the internet connection. The family navigators do a family needs assessment, and we find that families who need assistance with internet don't understand how to utilize the technology. What's a Chromebook versus a laptop versus a tablet? Power School, how to log in, how do I know if Wi-Fi is actually connected and the computer's connected? Google Meet. So we've all jumped into this virtual world of communicating and learning. And so we have found that we need to support our families, parents, guardians, and students to be able to utilize all of these platforms. So that's that second tier of families. And then we have the third tier of families who require both internet, they need help with technology, and then they also need a family navigator to connect them to food, housing, mental health services, physical health resources. Families, really are struggling and really need connection. Not only not having access to food or not knowing how I'm going to pay my bills or trying to decide, am I going to pay rent? Am I going to buy dinner, or am I going to, pick up my prescription and pay for internet, right? So, the idea is that the family navigators complete the needs assessment to really understand and support the needs of the family. And I just want to highlight that the internet that's being provided is free of cost for the families through the funding and the generous funding that we have received to support this initiative. Families who qualify for this program and have the internet installed will have internet for the school year, again, to support their this learning model. So the Family Navigator program is really, it's built on a trusted relationship between the family navigators and the families, and those who are referring the families to us. So referrals come from the Norwalk Public School staff. Anyone in the Norwalk Public Schools can submit a referral once they've identified a family who needs assistance. And so the family navigator is able to reach out to that family and really just offer services and support. The idea is that we're creating or providing peer support, mentoring, direct assistance for families in need Family navigators are reaching out to the families. They are identifying through conversation the strengths that the families have, and then where can we help build that relationship and connect families to services. We are collaboration between the navigators and the family, creating a family plan that focuses on the solutions and keeps the family member at the center. It's really the idea, it's family focused. It's absolutely voluntary. We call the families, we offer the services, and they say, yes, I want to participate, or no, I'm okay, thank you for offering. And so the family navigator works with the family once we've identified together the needs, the priorities. There are times that we call the family and say, you know, do you need internet? And they go, yes. And then they say, but I really do need food, or I need assistance with housing. And so we support the family. We start the process to getting them connected to the internet, but we also work on making sure that we're addressing those immediate needs, getting them food, picking up food boxes and bringing it to the families, making sure they know about all of the food resources and the community organizations that provide food assistance, housing, utility assistance. And then understanding that distance learning and technology, it's difficult, and identifying the supports or critical resources available within the schools. We've all, again, been thrown into this virtual world of communicating, of holding our meetings, working, and our families who may not be used to that format have really utilized the services that the Norwalk Public Schools have set up through their technology department to really support these efforts. They have the parent university where families can log in and get some guidance on how to utilize the technology. And so it's been really helpful, and the collaboration has really strengthened through this effort. So we provide three types of support: material and concrete. So we are getting internet wired into the families' homes. We are connecting families to resources. We're providing emotional support. Sometimes families just need parents, guardians, students. They just need someone to listen. They need that connection, to know that someone is there to support them, and to really help them identify resources. So family navigators are talking with families, speaking with moms and dads, parents, grandparents, to really support them through this difficult time. And then information, providing them with the resources in the community, making sure that when we are making a referral, that it's a referral that they meet the criteria and that they can access, and that it's culturally sensitive and that it's accessible. We're not going to send someone who lives on one side of town all the way to the other side of town when they don't even have transportation, right? We don't want to create challenges and barriers. So making sure that we are providing information and resources and connecting them to resource that is culturally appropriate, that the family feels comfortable with accessing, and that's accessible. So overall, it's this idea of identifying the needs, educating, and really empowering families to utilize the resources within the community. So eligibility and the reasons for the referrals. What we have found is that many students are being referred for significant absence from virtual classroom. So the family navigator will reach out to understand, how can we help? What's going on? Your teacher's noticing that you're not, attending. How can we help you with that? If it's an internet connectivity issue, we're getting them that internet as quickly as possible. Unable to contact or reach the family, family requests basic support for basic needs. Some families, what we've learned and what we know is that families contact those that they trust. Whether it's a member of the community, a member of the school, building those relationships. The families are letting staff, teachers, guidance counselors, supports within the schools, that they need help, that they're having a hard time. And many times this is coming up through casual conversation, This is coming up with, the school's efforts in reaching out to the families and saying, how can we help? We've noticed a change, and those referrals are coming in. A significant cultural and linguistic challenges. We're lucky to have family navigators that are bilingual, that speak Spanish and English, and also Haitian Creole. And so, they're not all schools have the ability to support all the languages, or there's a need to contact the families as quickly as possible, and the family navigators are able to assist with connecting with those families, but also helping families who speak these different languages, connecting with resources in the community, understanding which organizations do provide bilingual services or bilingual staff that could to assist them and help make that connection. Again, culturally, being culturally sensitive and competent in thinking about, what are some of the barriers that the different cultures or challenges that they may have in asking for assistance, and helping, again, emotionally helping support them through that process. And then identifying, again, families with no internet and connectivity challenges. So helping with basic technology and guidance. The family navigators guide families to the Norwalk Public Schools online portals when they need help and walking through the supports available to them. So they're able to contact the parent university, the Norwalk Norwalk Public School online portals, and they either participate in a Zoom webinar that does a tutorial, or they're actually able to speak to someone to walk them through the process. The family navigators have gotten some training for that basic, how do you log into, how do you find the Wi-Fi? How do you log into the Wi-Fi? How do you log into PowerSchool? What is Google Classroom versus PowerSchool? How do I know if my child is attending school, right? And accessing PowerSchool. And then when there's a more significant need for assistance, we're referring them to the Norwalk Public Schools online portals to provide that assistance. And that assistance is offered in English and in Spanish. So where are we at with helping families? So as of Friday, we have received about 769 referrals in total, for families who have been identified as either needing connectivity assistance, basic needs. So this started back in August. The Community Services Department started to receive direct referrals in November, and in total, we've received over 700 referrals. The family navigators are currently working with 478 families directly, and out of these families, 249 have received internet wired into their homes, are eligible, have been approved, have gotten the internet into their homes, or are awaiting installation, but they have been approved. Out of these 478 families, families are 334 are receiving basic assistance with basic needs, and 80% of the families are Spanish dominant, and 70% of these families are in need of more than one basic need. So it's a combination of, not only the internet, but food insecurities being the most requested assistance needed, housing, navigating the healthcare system, wanting to access healthcare, needing to understand the difference between telehealth and an in-person visit, and when is it appropriate to still access the emergency rooms, how to connect to mental health services. Utility assistance is another needed request that we've identified, just trying to understand, how do I pay for electricity? How can I pay for gas? Is another basic need that we've received from our families. The newest referrals is Internet connection, or the reason for the referrals is internet connection has been obviously the priority, but assistance with technology and the significant absences. Schools are identifying that students aren't consistently logging in. And so, how can we assist with that? And sometimes we're contacting families and they're saying, I couldn't pay for internet this month, or I'm not going to be able to pay for internet, or I need assistance. I don't have childcare. And my elderly parent is helping to assist with childcare. And so we're finding, several reasons why students aren't able to fully participate in online learning. A little over 200 families declined. They didn't want to share their personal information, or they weren't eligible for services. And so what we have done is we have continued to offer and keep that door open, especially for those who just didn't feel comfortable. They have our contact information. They know they can contact the Family Navigator if at any point their situation changes. And again, I think that goes to the building of trust. Someone is calling their home and saying, we received a referral, and some families are skeptical. And then they hear from the community, no, someone in City Hall helped me. It's okay, you can trust them, call them. And we have received those types of calls to say, I heard you help with getting food. I need that help. I know you called me, but I'm ready to get that assistance. We still have about 84 families that we're trying to reach, and that started with the program. They've gotten the internet connectivity, and our Family Navigators are reaching out to them again to offer the additional supports that the Family Navigators can provide. Any questions?
I know Madam Chair said she may have to go off, so there you are. You're back. So through you, Madam Chair, we'll entertain any questions. You're on mute.
Sorry about that. Yeah, I had to stand up and stretch a little bit. I did have one question myself, Maria. What kind of feedback are you hearing from the Family Navigators? What are they encountering specifically? Or is there any information there that you can share with us?
So the Family Navigators are, the families that are engaging, it's very clear that there is a need for assistance. It really, some families just didn't understand that they could ask for help, that they could utilize resources within the community to assist them with the things that they've been struggling with. Things like, food insecurities, just not knowing that they could, go to the food distribution site to pick up food, that they could go to what organizations in the community offer food. Childcare has become a frequent concern that families have. We're working with working families, right? The families that are still working are trying to balance, how do I go to work because they can't work from home? How do I support my child in online learning? And how do I still make sure that, everything still gets done? And so families are, telling us it's really hard. And so, yes, my student may not be able to participate, but I just don't have anyone to stay at home with them. I think that the health department has done an amazing job in communicating what we should be doing and how do we keep each other safe. And so families, some families are telling us, I know that I need to quarantine, so I can't have people coming into my home, or I have a family member who's at risk. So those are some of the things that are coming up with the families. But I think just the overall need, of food, access to food, trying to decide which bill am I going to pay? How do I keep my lights on? We had one family that they were set up to get internet. And then when we called to confirm internet was being installed, their lights were out. So we had to work on getting their electricity back on so that then we could have the internet installed. And we're working through families, working through the shame of asking for help, right, and accepting help, and supporting them, with going through that.
So what I'm hearing, I think, is that, we've been so fortunate to get this funding for, for the internet, but the needs are so great that, I mean, can we say it's successful on the education front? I mean, are the kids really able to take advantage of it? I mean, I know that this, I listen to my own daughter, who's struggling with her two little kids and working full time, and they manage. They're able to manage. They have a home to live in and pay their bills, but it's so hard.
It really is hard. And so I think with our partnership with the schools, we'll be looking at, what are the improvement rates? We do get feedback from the teachers that say, thank you so much for assisting this family. They're logging in. They're back, back online. So we are hearing directly from those who have referred, because we are following up with those who directly refer students to us. And then we're getting from the families themselves just, the gratitude, of saying, thank you for helping me feed my family. And just being able to utilize or connect the families to the resources, knowing that, the lights are turned back on, right? That housing, and thinking about how complicated these systems are. Trying to get your Section 8 voucher from that might have been in Stamford back into Norwalk, or, not being able to find housing, and then not knowing how to transfer that, and just knowing who to call and where to start. A lot of families really are just struggling with, where do I even begin, right? The challenges that they're facing it's like a Mount Everest. And so the family navigators are holding their hands and chipping away, and figuring out how can we, start with the easiest piece, right? What is it that we can quickly assist, and provide assistance?
Mm.
And Madam Chair, to your point around we believe it's working, but that's a perspective, and that's what people will call qualitative. So we also receive funding from the Ritter Family Foundation and the Parent Heinrich Foundation. So we actually have been able to secure an external evaluator who really would help us to quantify. So the needs assessment that Maria is referencing is an evidence-based assessment that all families have to go through. And not to bore everyone, there's a pre-survey, a post-survey to help us understand. And then the second piece is the partnership with Norwalk Public Schools and Norwalk Acts. We are able to track the students that are with the Family Navigator program to compare it, again, I'm not an evaluator, so that's definitely not my strength. That's why we have the evaluator, but they're going to help us be able to quantify and help us understand, because the question is, because of the Family Navigator program, were children and families better off? And that's what we want to prove. And, we are saying absolutely, but I think the evaluation will be able to substantiate and confirm that. We know that the families who receive services, we're hoping to say that through an external evaluation report, that families were better off.
And if I can just make an observation as a former teacher in the district myself, I mean, you look at your classroom of students and, you don't know their story. You don't know their story. And, teachers really, certainly the teachers I've worked with have a great deal of compassion. But I think that, this pandemic has really shone a light on the disproportionality that is out there and what our kids deal with. And so, I like to think that it's created more compassion among our community and among the education community, as well as, just and we are seeing some improvement. So so that's good. Mr. Burnett, you had a question.
Yes, actually, two questions, Maria. One, what would make a family ineligible for services? And two, at what point do the family navigators, I'll say, use the word disconnect from a family and say, okay, you're now independent and move on? Because I would think it would become overwhelming if you stayed completely connected with every family that you reach out to. You just don't have the bandwidth with the number of family navigators. So at what point do you say, okay, you're on your own and move on?
Okay, great questions. So the first question, what makes someone ineligible? So what we do, if someone has a current, has internet installed and are able to pay for their internet services, then they would not be eligible for the internet program, right? But if someone expresses financial hardship and they tell us, I'm unable to, I'm paying for internet today, but next month I may not be able to pay for internet, we're submitting that family for assistance with connecting them to resources. So that really would be the only reason why someone wouldn't be eligible, is if they have an active account and they and they tell us, I have internet and I don't need internet, I'm fine, would make them ineligible. We still ask if there's any other way we could assist and provide services if there is any other assistance needed. And then as far as how much support or how long do we support families? It's a great question. It's part of our training and part of our program is identifying how do we meet the goal, right, and the expectations of the program. So I go back to that idea of, connecting with families, receiving the referral, educating, identifying the needs, educating, and then empowering them. And so through the needs assessment, we look at, what are the priorities? How does a family go from just not knowing where the food pantries are to knowing where the food pantries are and then accessing the food pantries? And so what we're doing is we're tracking that and monitoring how often are we meeting with families, and then looking at a time where we're coming back and saying, have you accessed, and following up and saying, have you accessed the food pantry? Are you able to ensure food for your family on a consistent basis, right? 7 days a week, 3 meals a day. Are you able to provide that? And so we start to reduce our contact with the families until we feel and they feel that they're confident enough to access the resources. So we're working, and it's so fluid because we have some families that when we first call them, it's just internet that they need, right? But they know they can call us back if something else comes up. And we've had some families that say, I've now lost my job. I need help with getting food. I need help with paying my bills. I need help with, how am I going to pay the mortgage or the rent? And so then we have to go back to that needs assessment, identify and connect them to resources, and then making sure that they connect to resources, and then make sure that they know that the door is open if they need, if another need comes up. So I can't give you a definitive, after 3 weeks or 3 months of working with a family, they're done. Is we follow up to ensure that they're accessing the resources that we've provided with to them, and that we're available for support, and then transition them out through the program.
Great, thank you.
Thank you.
Other questions? Mr. Keegan?
Yeah, hi, thank you. Maria, I just have a question. Excuse me. Was this all driven by COVID, or was this initiative or program already in place, or was it planned to be put in place? Because my question is when COVID is over, and let's all keep our fingers crossed about that, and there is no need anymore, I don't think, for internet because the kids are going to be in school, what happens to this program?
I'll definitely jump in there, Councilman. Yes, this was driven from the Dahlia Foundation's need to support all residents of Connecticut around connectivity, because that is one of their pillars, if you will, or part of their mission. But to your point around what happens, I mean, I think that's the million-dollar question. We really don't know what, everyone's been talking about the new norm, right? Will there be some reiteration of there may still be a need? I think that remains to be seen. I think what we do know is that what we have learned is that families need support. And it's not necessarily the resource per se, it's just having someone help them understand, which is really the hallmark of the program. If I need help, where do I go? Because a lot of families just don't know. And that's why I like the word family navigator. We're helping families navigate through the systems because they have to receive services. So it's almost like a map, we're helping them, and they have to take the compass and say, this is where you go for this. And this is literally what happens. This is where you go for this. Oh, I didn't know that was here. Well, let us help you understand what's required and so forth. But that's a question we're talking with our funders. That's the conversation we're talking with the Norwalk Public Schools. But, I tend to believe that there still will be a need. The question is what that might look like.
Thank you.
Mr. Sachinelli?
My question is a bit of a follow-up to what Mr. Burnett had before. So if, and speaking to what Mr. Daniels just said, what's capacity look like? If we're enabling these families to move forward, should we be marketing this right now? Should we be going to market and trying to bring more people into the fold here? Or have we reached capacity? What's that?
Well, this is a grant. So the Dahlia was very specific. The funding allows us to serve 1,000 families. And I think to Councilman Burnett, the goal is not to have 1,000 families at one time. And if you recall the slide deck, some families just need internet. Like, I just need help with internet. I'm fine, as Maria pointed. And then some say, I need internet, but help me understand what this stuff is. And that's that tier 2. Well, and then there's that tier 3, which we often say, the hand-holding families. I'm going to, that extra care. And that may, and I know Maria didn't talk about time, but we're averaging around 3 to 5 months. But the goal is to work with them, understand, empower them, and get them moving. Because from a nonprofit perspective, you don't want them relying on you. You want them to be empowered to say, I now know person to person. I now know the alliance. I now know this place. But what we found, and Maria could add to it, although we know these agencies, the families that we're working with, they're not connected to the social service delivery system. The families that know it well, they know where to go. But in Norwalk, we have a significant population that just don't understand it, which is, again, why I think the need for the community services department is really critical to help amplify and bring awareness to the services and help people navigate where to go to help.
And I think the family navigators are also assisting with building trust within the community. When a referral comes in because a teacher, has a relationship with the parent and speaks to the parent, and they send the referral to us and we're reaching out, we're telling them, these are safe places where you can access help, right? Because, some families they're just concerned. If I access these services, am I jeopardizing my status? Is it okay that I access these services? And so the family navigators are doing an amazing job of building trust within the community, of saying this is a safe place to ask for help, and then connecting them to the resources in the community that we know they can access, and that it is a safe place, to be able to share their story and to be able to receive the help that they need.
Ms. Revolus?
Okay, so and already know I have questions about food, so I'll pass that. But with the services, for example, that you're connecting with, let's just use person to person, for example. How connected is the the Family Navigator program with these services to help that transition or letting go of families? For example, let's say a family needs internet, food. Oh, and I'm just gonna add South Norwalk just because I know the area. The family needs internet, food, rent assistance. Okay, so you have ABCD, you have person to person, and then let's say for electricity problem, let's act that. SNU would be the people that would be around here for a moratorium. Let's just say this. So person to person follows up after like 3 to 6 months. Depending on what you're doing with ABCD, they follow up with the family, let's say if they needed rent assistance or so on. A SNU wouldn't, but now they're listed as someone who's listed for moratorium. So if this was to dismantle in any way, or for longevity sakes, or for the stability of the family, has there been any conversation within this program and the programs you're servicing to help with these follow-ups and follow through that they normally do? So that, let's say maybe that you guys couldn't do it within the, you got the 1 to 3 months, but they got 3 to 12, for example. Just wondering, has that been conversed about at all?
So we follow up with the families as we're working with them, and if a family says, we're fine, we still follow up a month after just to check in and say, just want to make sure everything is going well. Is there anything else that we can assist with? And then each organization, like you've just outlined, has their own protocol for following up.
Right.
And so we would have to look at how do we continue that, as time passes. But that's a great point that we would have to.
Yeah, and just to also help maybe that data of, because of course this was meant for education, right? But these things go around it. So on the data points of raising how this helped, these additional points, maybe working with you guys can access that in a longer time for, of course not now, but in a longer sense, because we helped these many families, or we were part of helping these many families, and we did this, and you can connect it right to, and because of this, these children are doing, you know what I'm saying? And if you can't go past the 6 months, they can go to 12 in a sense.
Councilwoman, just to add, I think that's the role of the external evaluator. They're going to help us understand, in order to continue this program, in order to, that's what they're going to do. In any evaluation, we found the Family Navigator program was effective in this way. However, should the program do X, Y, Z, it may take additional resources and then help us identify them. So having that external evaluator will kind of help us look at, how do we, because I think what I hear you say, you're talking about sustainability, not for the program, but again, how does the family continue and meet their personal goals, whatever that might be.
Mm-hmm. And even with that, with the outside analysts of this, he or she would take that information as well from them. But of course, it would be a longer stint. It wouldn't be the right now of things, of course. But in conversing now that, okay, we have connections to these people to this in time, and we work with this, and this program.
You're right on. You're right on. Absolutely.
Okay. That's all. That's my question.
Thank you. Anything else? Ms. Johnson?
Thank you. I'm following up a bit on what Council Member Keegan asked, which is that since this was so clearly the Dalio initiative responding to necessity in COVID, I'm just really curious to know what, and I know the evaluation will shed light on this too, but what do you think are some things that that will stay with you, that you'll take with you, and I know this new work you're all doing at City Hall from this experience?
So I think coming out of this is that we're hearing from families who, again, going back to that building trust, right? They're sharing their most vulnerable, they're in very extremely vulnerable states, right? And they're sharing and opening up to the family navigators and saying, I need help with this. And it's not always easy. You know, for many of the families, we have to have that first win. We have to connect them with that, you know, what is their biggest priority? And sometimes they'll give us just a little piece of what it is that they're struggling with. And when we are able to meet their needs, then they're like, here, I have a whole list of things that I would like to talk to you about, right? And calling these family navigators. And so I have to really commend, you know, the referral process, the work that the family navigators are doing to connecting with these families and building trust, and again, in a very culturally competent way of, you know, navigating and just being available to the families, and to hearing the stories. When you hear a story of a single mom, you know, with 3 kids who's trying to, you know, keep up with her hours, and, you know, an older child who's trying to pick up, you know, some hours, you know, on doing a part-time job to pay, you know, and support the family and help support the family. And we come in and say, how can we help? And they, you know, it's a sigh of relief. And to be able to connect them to, and saying, you know, this is where you can get food, so you don't have to worry about that, right? This is where you can get clothing, you know, because now it's cold, right? We've had families that are saying, you know, my husband's not working and we can't buy coats. And so being able to help these families in situations or things that we may not think about, and to think about, you know, in general, everyone's struggling with balancing COVID and working from home and taking care of children or family members. We're hearing about a lot of family members that are taking in other family members, and trying to balance that. And so we have multiple people living in one household, and trying to support. And so, you know, I think the biggest takeaway for me is knowing that residents are letting us come in. We're listening to them and we're able to help them. And it starts with, you know, one thing. I think about the family that said, you know, I need an appointment, you know, for my child to get a physical. And it was like, we can do that, right? We can help you with that. And so we got that win. And then they were like, can you help us with this? And, you know, can you help us with, you know, I don't know if I'm going to keep the lights on. Can you help us with keeping the lights on? And so we connected them, you know, to the Alliance, who's able to do that. And I have to commend our community organizations and the nonprofits that are stepping up and ensuring that when we call, their arms are open and helping and taking these families in and assisting them. So I think the biggest takeaway is that families, you know, are in need. You know, it's the food insecurities, it's the housing, it's the mental health support of trying to manage the stress of keeping everyone in their house healthy, keeping the lights on, keeping food on the table, making sure that the child is logging in. And so, you know, that mental health component of being able to utilize our mental health providers and supporting these families in their time of need.
Thank you. It does seem like this collaboration has strengthened these relationships with city organizations, nonprofits, and that's something that will carry through.
Absolutely. It's really strengthened and has helped us to identify, you know, how do we make this a seamless process, right? How do we remove the challenges and the barriers of a system and being able to take that referral, take that call, and take that family and bring them over and connect them to resources and making it as seamless as possible. We don't want to create a burden or create challenges. So our job is really to be able to make this as seamless as possible.
Thank you. Thank you.
Ms. Revolus.
I forgot a part. So 2 more things, just, and as you're talking, I just want your quick rate, just how you feel. As with languages, when you get online, especially with parents, how do you find language accessibility is on the internet for you, especially with, you know, NPS? I do know we're trying to change the, you know, the abilities of having several languages of all types, but just, again, even if they have access and need help, but, you know, if it's still not in my language, even if I'm looking at a screen. And then we also have the person, you have the person who doesn't read their tongue too, but just wondering language accessibility once you're looking at the screen. And my second question is, I know the day and age and whatever with pandemics, again, going back to why I feel about food, but how have we tried to connect, especially with that trust and community? Has there been connectivity to the families you're working with, so maybe they can kind of get to know each other, A, which strengthen the conversational piece of it, and B, like, for example, if I get to learn to have a little trust, that might help in child's care or whatever, that just because in like the synchronicity of we're all being helped in this manner. And oh, if I don't forget this, when you see professionals like mental health or whatever, is there any connection? This may be well too deep for you guys, please, but it would be great for, like, let's say if I'm a Black child, Black family, Black woman, I need mental health services and I can find a Black doctor. Those are my questions.
Okay.
That I forgot. I'm sorry.
I'm here taking notes.
I'm sorry. I just spit them out because I forgot the last time. So I was like, let me just say them. So
as far as language, when the family navigators are contacting families that don't speak Spanish or Haitian Creole or English, they're utilizing the language line that the city provides to assist with that. And so when they are doing their basic navigation of the computer, they're utilizing that to assist them with that communication. So again, we're utilizing every resource available to us. Peer support.
Heavy. So good.
So creating peer supports. So part of the wraparound model is to identify what are the informal supports. So we're not only looking at what are the formal supports, what are the organizations that can help, but we're also talking to families about who do you trust, who do you count on. And we know that that's really important within the community, and thinking about the different cultures, right? And who do they see as a community leader, and who do they really trust? And so the navigators have had to have those conversations with families, because when we're working with a single mom who says, I'm working and I have to be at work by 4 a.m, is who we've had to have the conversation of who do you trust to come into your home, right? To help with making sure your kids are logging in. And sometimes when someone is in a state of, I just don't know how to manage this, is just too much, I have to go to work, I can't deal with this, that through conversation, we're able to help this particular person with identifying, oh, that's right, I can count on my neighbor, or I do have someone who I can count on. So sometimes it's just through conversation is we're looking at what are the informal supports, because we don't have an answer for everything.
Is there support groups? I just thought of that, like, again, maybe way too much. Is there a support group for families themselves, so maybe, or moms or parents, to sit around a table within the Navigator family, so maybe they can do that within each other?
So we do connect families to organizations that provide peer support programs. And so when we have families, that really need that support, we are referring them. So I anticipate that they are meeting through those parenting,
other
peer support. Gotcha. Yes. Yeah.
Gotcha. And there was a third question. I don't even remember.
Peer support language.
That's why I said it out loud like that, because
Well, let's say, how about follow up with email? So
that sounds good.
That's email, but thank you
to Ms. Escalera, and we can move on to item 4C, which is our presentation on ELL school-based initiative by Mid-Fairfield Child Guidance staff. So, Mr. Daniel,
thank you.
would you like to introduce?
We're ready for that?
Yep.
Great, thank you. So thank you, great discussion. So 3 weeks into my new role back in 2019, I was immediately emerged into the new influx and new arrivals of children discussion in Norwalk. And this was my first task. And I was charged with bringing together the community to, as a new department under the mayor's request, to figure out what is our role. Norwalk needs to help. Norwalk needs to help figure it out. And fast forward, as you all recall, it was my first presentation to the Common Council, myself along with Dr. Adamowski, where the Common Council approved a special appropriation of $1.4 million to support the children, both on the school side. And then as I was thinking through, I asked to pull the 400,000 out and let me manage it. And as a result, as a LCSW, really worked, helped identify what would be the most appropriate services. But not only that, who has the expertise to work with children newly in our country on many levels. And then, as you all know, we were able to secure the contract and support for Mid-Fairfield. So as Madam Chair mentioned earlier, we're really excited to have Mid-Fairfield Child Guidance Center. We are now, a year has passed since the Common Council. And again, I personally want to thank you for approving the funds to support this needed work. And then lastly, before they introduce themselves, this program, this initiative has become a model. It has become a model both in a region and across the state, where other municipalities and other organizations from a variety of sectors is asking, how do you do it? What is going on? So I think it's important to note that we are being looked at as a leader into a private-public partnership to support our most vulnerable children who have not asked to come, but for a variety of reasons. And our colleagues at Mid-Fairfield will be able to talk us through. So they also have a slide deck. In terms of administrative, as the city entity, I am the administrator of the funds. They are required to submit monthly reports. We have biweekly, I'm looking at Marissa, almost daily conversations, not only to be a support to help them navigate, and also to get updates so we can better understand how we are serving our residents, in this case, children who require some really high need and specificity of services, given their experience, their trauma, and all that has come. So I want to welcome our guest tonight from Mid-Fairfield. I'm looking at Gail as the executive director, and you can introduce the team, and then please put forth your presentation to the Common Council Community Services Personnel Committee. Thank you, Gail, for being with us this evening.
Thank you. Thank you so much to all of you for allowing us the opportunity to present about this amazing program, and my staff will present all the details. I'm Gail Melanson. I'm the Executive Director of Mid-Fairfield Child Guidance Center. I've been with Mid-Fairfield for over 20 years and have worked closely with the Norwalk community and the partners in the community. And this is an amazing example of how well these partnerships can work together. So Marissa, I will turn it over to you.
Thank you. I am just going to share my screen. Let's see. One moment. All right. Can everyone see?
Yes.
We good?
Yep.
Yes.
All right. So as Gail mentioned, we are with Mid-Fairfield Child Guidance Center. And I thought it would be also joining us this evening is Clara Mesa, who is Director of Community-Based Services, and Clara actually manages the English Language Learners School-Based Initiative. And I thought it would be really helpful to give you a brief overview of Mid-Fairfield, our programs and services, prior to getting into the bulk of the presentation. For those of you unfamiliar with our work, we specialize in helping the growing number of children and adolescents, birth through 21 in our community, who suffer from severe mental and behavioral health disorders due to stressful life events and/or experiences of trauma. We are the safety net for families unable to access or afford private behavioral health services for their children, and no child is ever turned away. We adjust our fees based on what a family can afford. The children and adolescents we work with struggle with a wide variety of mental and behavioral health needs, such as depression, anxiety, PTSD, and attention deficit disorder, just to name a few. We have over 50 employees, which include board certified child and adolescent psychiatrists, clinical psychologists, social workers, other mental health professionals, direct care, and support staff. And in November 2018, we received our adult license, which allows us to continue providing mental and behavioral health services to young adults 18 or older who would have otherwise aged out of our programs. I really love this next slide as it provides you with a brief snapshot of our programs and services. A couple of things to highlight. All of our services include evidence-based individual, group, and family mental health therapies, comprehensive psychiatric evaluations, treatment and medication management, advocacy, parent guidance, and care coordination services. We provide care to the entire family and not just the identified patient, and our programs and services are provided across the lifespan of a child and adolescent. We also work very closely with other organizations in the community to ensure our families are supported. Over the last few years, we have made tremendous progress in meeting the needs of the diverse populations served by our organization. We are the primary provider of comprehensive bilingual mental and behavioral health services in the community. We exist solely for the purpose of serving children and families where the language barrier impedes access to care. And we've been able to significantly expand and enhance our bilingual services with the support of our philanthropic partners. We currently employ 21 bilingual, bicultural, clinical and non-clinical staff, and currently have 3 bilingual interns. In 2016, Mid-Fairfield was approached by Norwalk Public Schools to work with English language learners enrolled in the Norwalk International Academy at Norwalk High and Brian McMahon High School. With funding from the Department of Children and Families, we were able to train our bilingual clinicians in school and group-based trauma interventions. This really began our partnership with NPS in helping to support the mental and behavioral health needs of this population. The slide you see here shows the growth in the L population in Norwalk from 2004 to 2019, with many English language learners arriving from Latin America. As Lamont mentioned before, in the fall of 2019, the City of Norwalk approved a $1.4 million special appropriation to support the educational and mental health needs of English language learners. Of these funds, Mid-Fairfield received $400,000 to create and implement the English Language Learner School-Based Initiative, which provides embedded school-based and in-home clinical treatment and care coordination services to immigrant children and adolescents and their families arriving in Norwalk and attending Norwalk Public Schools. I am actually now going to turn over this presentation to Clara, who will really get into the details of the program and the needs of this population. Clara?
Thanks, Marissa, and thank you all for being here tonight. We're really excited to tell you about what we've been working on and what we look forward to hopefully continue to work on. So it's important to start with what Marissa's already stated. We've had a significant influx in immigrant families and in turn Norwalk Public Schools L students in the last few years. These students have come to Norwalk not by choice in the traditional sense, but by necessity. They have in many cases been forced to leave their native countries due to life-threatening situations, including community violence, chronic physical abuse, exposure to domestic violence, political unrest, and other traumatic events. Many of these students and their families chose to come to Norwalk because they either had a family member, friend, or acquaintance living and thriving in our community. If you take a look at the graphs, on the bottom left, you can see how many families had 7 or more basic needs that were not being met at the time of intake. This can include things like food, housing, medical insurance, and at the bottom right, you'll see how many traumatic exposures each child had. Particularly note how many students had at least 2 or more trauma exposures thus far. Trauma, acculturation, and separation are 3 of the most prevalent stressors that are shared with our team when we're getting to know our families. In many cases, families are initially reluctant to receive support because of their prior experiences, and this can be because they were either detained during their migration experience, separated from family members, or they're concerned around their current immigration status. Due to the vulnerability of this population and the pervasiveness of the traumatic exposures, many students and families actually underreport their traumas, which then increases the risk of long-term negative effects, including somatic complaints and poor physical and mental health. Without access to the proper supports, they can develop unhealthy coping skills, which won't only negatively impact the child, but the entire family unit. As families acclimate to the US, they're met with the stress of learning a new language, learning a new culture, a new set of norms and values, and a new education system. And it's important to note, acculturation is completely an individual process, so it can cause a lot of strain on the family when each member is in different stages. And we see this very commonly because kids tend to acculturate at a faster rate than their caregivers. So it's also important we factor in separation because within the immigrant population, there are many layers to what this may look like. In some cases, families have been able to immigrate together, while in other cases, kids are leaving primary caregivers to live with a new caregiver who is in many ways a stranger to them. So let's put this into perspective. If you picture yourself as a 12-year-old and you've lived most of your life with your mother and your grandmother, and then suddenly you're forced to leave them and everything that you know because of violence to live with your father, who actually left your native country 5 years ago, so you don't really have a relationship with him. So now you're essentially two strangers living together where he has to learn how to be a full-time parent while also continuing to financially support your family back home. And you have to learn a new language, make new friends, and develop a relationship with your father. It's also important that we know many of our caregivers are reporting that they've had to leave other biological children in their native countries and very unsafe living conditions, which is constantly on their mind and worrying them. And as you can imagine, this has a profound impact on their own mental health and their ability to be fully present for the kids that are here in the US with them. Starting a new school is hard enough as is, but add in the fact that you do not speak the same language as your peers, and the rules and the expectations differ largely from the ones that you've been practicing thus far. So how can you fit in and how can you make friends? Without proper supports from the school and/or community, how can you be expected to successfully engage in the learning process? We strive to ensure that this vulnerable population connects with community resources like our own program so that they can receive equitable educational supports. In Norwalk, 66% of Ls graduated compared with the non-L rate of 94% in 2019. It's with the collaboration embedded in programs and initiatives like ours that can help to improve these rates. And by providing the social emotional supports to the students and their families, we can also educate families with regards to the expectations that are held within our school system. We want to encourage caregivers to be active participants in their child's education. So for example, a few months ago, many of our families started reporting that they were receiving letters regarding excessive absences from their child's school. We of course encourage the families to reach out to the schools directly, but we reached out ourselves too so that we could get a better understanding of how attendance was being tracked. We were then able to bring this information back to the students and the families so that they understood if the child was learning remotely, they needed to participate either via the chat function or video in order to be marked as present. And it's increasing positive communication like this and between the parents and the schools that can help families feel more welcome and in turn more involved. So that makes them more likely to want to continue to be a part of their child's education and future school activities. So how do we help? One of our goals as a program is to provide families adequate support in order for them to achieve a greater sense of self-sufficiency. Both our care coordinators and our clinicians work with the families to help identify and connect them to community resources that then really can help empower them to be able to access these supports independently in the future. So if a family is provided with the contact information for a local resource, and they're encouraged to reach out independently. During the next session, what the care coordinator would do is reach out to the family and ensure whether they've been able to connect or not connect with this resource. If not, they would offer to call with the family because even though the care coordinator can likely call on the family's behalf in many cases, that's not going to teach the families how to navigate the resources and empower them to do this independently in the future. And that ultimately is one of our goals. Our hope is that as we increase these numbers of connections each family has to the community, their sense of safety and belonging increases as well. Many of the families have already expressed their desire to stay in Norwalk as long as their means allow, but this is largely dependent on things like job stability, housing stability, access to food, and other basic needs. Marissa, you're muted.
Sorry, I'm on mute. So the program, I know Clara is going to be speaking about our service delivery model, but I did want to just share with you a little bit about our staff structure. Clara, who is absolutely amazing, is our program director. And with your support, we have been able to establish 2 teams, each comprised of a care coordinator and clinician, all Spanish-speaking, bilingual, bicultural. As Lamont mentioned, we meet, gosh, what seems like very, very often. And we also meet with Norwalk Public Schools to discuss what's working, the program, referrals, and analyze data as well. So Clara, do you want to talk specifically about the service delivery model?
Yep. So when we look at our service delivery model, I think one thing that's important for everyone to realize is that because of the influx of recent arrivals, particularly in 2019, when we created this initiative, our eligibility criteria was based around the influx, and we're targeting to serve kids who have arrived to the US in May 2019 or after. When we look at our clinical services, we're looking at an expected average length of service of about 12 months, though it's individually determined by the clinician and the family and what the clinical needs are. With our care coordination, it's based on our system of care wraparound model, and that average length of service for that would be 6 months and can be expanded to a maximum of 12 months. What makes our model particularly unique is that we have the flexibility to provide wraparound services to really meet the families where they are. And once we're able to fully re-enter schools again and be physically on site, we'll be able to not only offer these services during the school day, but we also have the flexibility to be able to offer home visits so that we can better engage the entire family system. When we first launched our initiative, we started off with the 2 high schools shortly before we all went into quarantine. Then at the beginning of quarantine, we were able to conduct a survey of the remaining Norwalk public schools to determine which schools had the highest need within the L population. And this is what led to our partnership with the 6 schools you'll see highlighted at the top. You'll also notice that there are many other remaining schools that are in need of our services, and our hope is that we'll be able to grow so that we can truly meet this need. For this slide, we're going to start with the top left. In our pilot year, we've received 60 referrals from the 6 schools mentioned on the previous slide. Of those referrals, we were able to open 40 cases for clinical services and 31 for care coordination services. Of those referrals that did not become active clients, only 3 families declined our services. The remainder were either due to difficulties in us being able to connect with a caregiver or ineligibility due to date of arrival. So those would be students that came before May 2019. And in these cases, we were able to refer the families to other community resources. And as I've highlighted before, this population is incredibly vulnerable, so I want to take some time to highlight some of the themes that we're noticing. As we work with younger students, we're noticing a higher vulnerability with regards to things like bullying, depressive symptoms, adjustment disorders, and separation anxiety. While we work with our adolescents, we're noticing a higher vulnerability to things like human trafficking, self-harm, elopement, and trauma reenactment. So the more we're able to engage this population in mental health services, the more we're able to build on their protective factors and their coping skills, which is what's going to help us to mitigate the risks associated with these vulnerabilities. As you notice on the top right, we have a pretty high rate of clients attending our sessions, which is comparable to our metrics in our outpatient clinic. This is largely in part to the connection that our families form with our team. Our staff are incredibly passionate about working with this population, and our trauma-informed approach creates a safe space for families to heal. Based on this being a pilot year and due to COVID, we don't have current data on impact yet available. However, we continue to review this data so that we can help inform our practices and our interventions. As we reflect on our first year, here are some of the successes and the challenges we've encountered. Like everyone else, COVID has challenged us to course correct from our anticipated plans in many ways, and it's definitely added additional barriers to our work, but there have also been some positives that have come from it. COVID impacted our L families at a disproportionate rate, and it provided us with the opportunity to be true advocates. We were able to collaborate with the city and Norwalk Public Schools to identify gaps in services when it came to things like the food distribution sites and internet equity, which we've been able to connect with Maria and her team around. We have supported and instilled hope in our families during this challenging time, and we're committed to continuing and expanding these efforts. We've worked with families to connect them to our local community health centers and set up sliding scales when necessary so that they can be encouraged to receive preventative care instead of emergency care, which is ultimately what's going to help reduce medical costs for the community as a whole. And engagement, while it's been tough with this population, particularly around stigmas around mental health in the Latinx culture, our strengths-based and family-centered approach is what allows families to feel safe and hopeful that resources are available to them. And as families continue to establish this rapport with our team, we're seeing that engagement improves, and that's ultimately what can make treatment most effective. In preparing for this presentation, we asked some of our families and partners at Norwalk Public Schools to share their thoughts and experience of our new initiative. We were incredibly humbled by their responses, so we wanted to share some of them with all of you. As Marissa mentioned earlier, we'll be able to get you a copy of these slides so that you can read through them. Many of them speak to the power of the partnership and the collaboration we've established with Norwalk Public Schools and the families that we're working with, and we want to continue to grow this. As you read through some of the caregiver statements, you'll notice several themes. The blue font is in Spanish, and the black is the English translation. One of the themes I'd like to highlight is improving the self-esteem and confidence, not just in the child, but also in the caregiver. Secondly, you'll notice themes of establishing trust with our team and helping the caregivers in turn feel heard and that their voice matters. And lastly, we're working on strengthening the relationship between the caregiver and the child, which is particularly powerful when we think back to what I mentioned about the role that separation plays on many of these families. The resilience and the strength of the families that we work with are truly inspiring and remind us all daily of why we do what we do.
Thank you so much, Clara. That was just a really great overview of the program, and just wanted to kind of share this last slide, next steps. A few slides back, you were able to see that we are currently in 6 schools and there are 19 schools in Norwalk. We would love to be able to expand the initiative by adding 2 bilingual, bicultural, clinical, and care coordination teams to accommodate the growing need of our services. We'd love to work more collaboratively with NPS to streamline the referral process, workflow, and protocols to ensure all eligible L students in need of services are identified. We very much hope to continue to participate in community-wide efforts. Our team is part of the Norwalk Immigration Coalition, and Clara has also participated in Norwalk Acts town halls. We'd love to formalize working relationships with community organizations that have expertise in immigration proceedings and legal rights and advocacy. And one of the things that we've realized more recently is training for staff on immigration law. There's not enough resources in the community for legal aid, and many of our families are overwhelmed by pending cases. So on behalf of all of us at Mid-Fairfield, we are incredibly grateful to all of you for your support, and Lamond and his team have been absolutely wonderful in helping us to get this program off the ground. So I think I will stop sharing. And Lamond, I think we open it up for questions. Anything else you want to add?
Thank you, Marissa. You all did a phenomenal job. I think the presentation speaks for itself. So through you, Madam Chair, I'll turn it back over to you. Thank you.
Yes, thank you so very much for that presentation. I have seen firsthand the work that you have done, in particular at Norwalk High School, and how very important it is. And that was pretty emotional for me to watch that. So I'm going to take some questions now. Mr. Burnett, you were the first with your hand up.
Yes, thank you, Madam Chair. I guess the question is directed to Lamont. From a funding standpoint, it was my understanding that the 1.4 that we approved last year, or actually in 2019, was somewhat of an emergency special appropriation. So my question is, where's the funding coming from to keep this program ongoing? I have not seen another special appropriation come through. So is the Board of Ed now absorbing the cost of these services, or should we expect to see another special appropriation? I don't know the answer, so I'm asking the
Sure,
question.
no, I appreciate it, Councilman Burnett. So in my budget, I have proposed to the mayor to continue funding for this program. As you've heard, it's needed. So in my budget to the mayor from the Community Service Department, it's being proposed to continue at the same funding level. I think it's also important to mention that the city, which I'm serving as representative, in collaboration with Mid-Fairfield, have been working similar to the model with the Dahlia Foundation of a private-public partnership where the city will continue additional funding and working with the philanthropy community in order to support this most vulnerable community. Those conversations are being had. We're constantly talking to many people in our state and even beyond, because these issues are real. They're not going to go away. But specific to your question, I have proposed in my budget to Mayor that to continue funding through the community services budget as opposed to special appropriation.
Thank you. Ms. Revelous.
Maria reminded me of my question because it's going to go into this too. Trauma, the acculturation and separation, I'm really glad you put that up because there is a community that lives with that, right? That's born right here. But my question to you, because of stories I've heard, not particularly with this, but out of Brian McMahon from actually instructors with students that are not, we have a big amount of Spanish speaking, but we do have children who need help who are not Spanish speaking, with instructions and clinical, all of them being Spanish. Especially again with job stability, I could also see that somebody who's not Spanish but has those criterias but not getting maybe a hire because they're not speaking Spanish. What are we doing for outside of, I know you're providing it, I just speaking it because we're live, for the person who's new in Polish, and I know there are, Haitian children who have come in that same predicament. But again, I've heard stories where, we can't communicate, they're not getting support, so on and so forth, because we do have it, but it's just, again, I can say Creole, but then it makes me think of like any other of the 64 different languages we have in our system that may need help.
So let me just frame it this way. I know for the purpose of this presentation, it was about this program.
Yes.
However, Mid-Fairfield, you can talk about the other services because I think you can respond to her, but I just wanted
completely. That's what. Completely.
Yes.
Completely.
So,
I just want, and I understand that. I just want to speak it, but completely. I get that completely.
Gail, do you want to take this, Gail?
sure, absolutely.
Okay, cool.
So we have several Haitian Creole speaking clinicians and care coordinators that work with families. And if there are other languages that we do not provide, we also, as Maria referenced, we offer Access Language Link for families that speak any language. And that is a service that we have a contract with them, and we can provide therapy services in any language.
And then in my role, looking at the gaps in services, Councilwoman, I just, I'm going to be involved in the Connecticut State chapter of the national associate of social workers to specifically, because I think at the other end is a resource need. How do we recruit and find clinicians who speak the different languages? And so
Right, right,
system, and that goes back to college, career, workforce, encouraging those who speak different languages from other cultures. We need you to feel similar to what they did with the large nursing recruitment, back in the 80s. We
Right.
need nurses, and they did
Right.
a huge push. So from a city
Right.
perspective, my role also is involved in systems, policies, and practices in terms of raising those concerns from a practice and workforce development, so we can ensure we're encouraging people to go into those fields
And,
of
and
all cultures.
I just want to add, Lamond, that Mid-Fairfield has a very robust internship program where we have interns from places like Fordham, Sacred Heart, and NYU. And a lot of the interns actually come on as full-time clinicians. And we were actually able to build our bilingual services by hiring 2 of our bilingual interns a few years ago, who then continue to work closely with the schools. So we are always looking for interns and developing the workforce. Yes.
The reason too why I just add this is just because, I hate saying this, but Black and Brown communities, again, the stigma with mental health. So finding clinicians that look like them, and you guys are doing it, but this speaking devil's advocate, I guess, for lack of better terms, I get what you're doing, but thank you for stating that, because it's exactly what I wanted to hear. Thank you.
Other questions? I'd just like to just piggyback on Mr. Burnett's question, and just with the community services department being new, this type of presentation is really important for us to see how the money is being spent and how the resources are being used and are available to our community. And so when Lamond comes to us, to the council, to the mayor calls us and asks, when we start these conversations about the budget process for next year, it's important that we have this information to inform our decision, especially with the department being new. So I would very much like to thank you for this presentation. It's very important work. I see Mr. Keegan has a question.
Yeah, hi, thank you, Madam Chair. Just in the beginning of your presentation, Gail, I believe you started it. Am I correct that you indicated that your services contract was $400,000?
Yes.
That is correct.
Okay. That's all I want to know. Thank you.
Okay, anything else?
And Madam Chair, thank you, because I will be coming to you all for your support.
I know. We're prepared. All right. Well, thank you all so much. Do I have a motion? Ms. Revolus, motion to adjourn? Okay, all in favor? Aye. Okay, good night.
Thank
you,
you, everyone,
thank
for
you.
your
Thank you all.
time.
Thank you.